Hello, welcome to Beat Burnout. I'm your host, Taniya Hussein. This is for you if you are a social worker or a healthcare professional and you feel overwhelmed and you can't do it anymore. You can't give, you don't have any more to give. During the series, we are on a mission to beat burnout. And I know burnout manifests itself differently in different people, in different times of my life. I've had it manifested in different ways. I am a social worker. I'm also a trauma recovery and stress management coach. And I've actually brought together top coaches and experts and authors from all over the world. And it makes sense because I am focusing on healthcare professionals to actually talk to a doctor. And today somebody is with me today. It's Dr. Shawn Jones, all the way from Kentucky, USA. He joins us and I'm going to be interviewing him today. Dr. Shawn Jones he's actually involved in the Kentucky Medical Association and American Medical Association for many years, first serving as resident representative for the KMA. He served on the board of trustees for 15 years and was on the executive committee prior to being elected president of KMA in 2011. He's currently president of the Kentucky Foundation for Medical Care and serves on KMA's AMA delegation. Dr. Jones helped champion a local smoke-free ordinance in, I'm not going to pronounce this right, Paducah, as president of the McCracken County Medical Association in 2007. He's appeared on KET-TV numerous times in support of smoke-free Kentucky, receiving a statewide award for his efforts in 2014. He was instrumental in the development of a physician wellness committee for his local hospital, as well as the statewide medical group to combat physician burnout. Dr. Jones wrote of his personal journey with burnout in his book, Finding Heart in Art, A Surgeon's Renaissance Approach to Healing Modern Medical Burnout. He served on medical missions to Romania, Honduras, and Kenya. He's fluent in Spanish. Dr. Jones is an avid reader, enjoying biographies, history, as well as books on spirituality. Welcome, Dr. Shawn Jones, to Beat Burnout, this interview series. I'm so glad to have you.
Thank you. It's great to be with
you. Could you tell us about your journey to how you're doing what you're doing now?
So I think I felt once I knew that I'd experienced an episode of burnout, and as I came through that process, I was in part helped by being associated with people who had drug and alcohol problems through Alcoholics Anonymous. And part of their program is helping others by mentoring other people. And part of that program recommends you do that in part because if you're helping other people and you're mentoring them, you're giving them advice. And at the same time, you feel a responsibility to do your best to stay healthy because you're helping other people, and that helps keep you well. Mm-hmm. And so I felt, number one, a desire to give back to my profession, because I think there's a misunderstanding about what it means to be or to have a problem with burnout and to get help in the helping professions. There's a lot of stigma associated with that. And I wanted to come out and say, hey, I had this problem and I came through it, and I'm still functioning and working and happy as a physician and trying to stay as healthy as I can. And it can be done, and don't be afraid to seek help. That probably was the number one thing that prompted me to speak out.
And I think, I mean, I've said this before so many times, it's kind of asking for help is something we social workers and healthcare professionals find really hard. And I kind of wanted to ask you, what was the most darkest moment that made you realize that you were burnt out? Hello? Yes, you're still here. Sorry, the internet connection is not very good.
I didn't hear the end of your
Sorry.
question.
Yeah, sorry. The internet connection is not very good at all. What was the darkest moment that made you realize you were burnt out?
So it
Or,
really was an episode that occurred with my wife at home, and I go through this in the book, but um, she just said, I think you need to get a CT scan or something, because she thought I actually had a brain tumor. I think my affect had gotten so flat. I was so depressed that she thought there must be something physical going on. And so I actually went to my internist and said, Jim, he's a good friend of mine. I said, Jim, I need a CT scan. He said, what for? And I said, well, Evelyn says I need one. And he said, well, how do I code for that? And so it was kind of a lighthearted moment, but in essence, I said, well, I've got a horrible headache. So we got a CT scan. Of course, it was normal, but that was sort of when I began to realize that I really was having difficulty. And then there was a moment when I remember looking in the mirror in the morning, and I recognized I wasn't feeling anything, that I had no emotions. And I knew that wasn't normal, but for some reason it didn't hit me, oh, I'm depressed. Because if you'd asked me if I was depressed, I would have said no.
of course. Yeah. Yeah.
So that was really the moments when I began to realize I had a serious problem.
And especially looking in that mirror is something we social workers and healthcare professionals find that hard to do. Just looking in the mirror. It's really, oh God, that just sounds really profound. And you kind of mentioned this, but I'm going to ask you again to kind of, what prompted you to reach out for help? Because that's when you kind of like discovered something was wrong. What kind of prompted you to actually reach out for help?
Well, I think there were a couple of things, but number one, I have to give a lot of credit to my wife. And I think that's why it's so important to be surrounded by people who care about you and live in community and not be isolated. Because I think if I'd been living alone, I probably wouldn't have gone for help. But she really insisted that there was something wrong and I needed to get some guidance. And when we knew there wasn't anything wrong professionally, that's when I sought the help of a psychologist. And that's when we began to notice, that I was suffering from PTSD. So,
Post-traumatic stress disorder. I mean, I hope you that are listening out there, because that is what burnout can manifest itself. It can manifest itself as depression. It can manifest itself as post-traumatic stress disorder. This is something that I actually have experienced social worker. It's only 2 years ago that I came across the concept of vicarious trauma, being actually traumatized by the work that healthcare professionals and social workers have to do. You can be traumatized by your own personal issues and experiences, but to actually be traumatized by the actual work that you do. That is something I kind of want people to kind of just hold on to, because I think when you have been surrounded by trauma, tragedy, and sometimes it's not even tragedy, sometimes what healthcare professionals, they're like saving lives. They've seen such, awful injuries. It's I was speaking to a police officer today, and we were dealing with a case of arson, and she was actually talking about her grandfather was actually in the fire brigade during the Blitz, the Second World War. And, and she said that he never ever wanted to talk about it. And we had Grenfell here, the really one of the worst fire tragedies where so many people died, and firefighters and police officers and loads of people were actually traumatized by seeing this awful tragedy of not just several people, but so many hundreds of people. And what when you actually you saw the psychologist, what help did you find? Was it easy to get that help? Was it easy to make that step?
No, and in actuality, it was a series of steps. At first, it was like, well, I'm going to drive and make an appointment and block off my schedule and, carve out this time to see this gentleman for an hour a week.
Mm-hmm.
And after that, it happened for a few weeks. He said, well, I want you to come in for a 3-day evaluation, outpatient, but still be 3 days of,
Mm-hmm.
I was like, I can't take 3 days off and, I'm too busy. And
Mm-hmm.
all the things that we say to try to justify why we're not getting help, of course.
Yeah.
And I felt like it was really important. I knew that there was something wrong. And so I went in for the 3-day evaluation, and that's when they really diagnosed me with PTSD related depression. And as you pointed out, I think burnout can manifest itself a lot of different ways, but PTSD is one of the primary ways that it can manifest itself from a DSM classification standpoint anyway. And so after that, they said, well, you can get treatment for the next few years. We think we can help you, or you can come in for 6 weeks of inpatient or outpatient intensive therapy. And I felt like I really wanted to get my life back, and that it was important that I take that time off and do that. And because I wanted to get better quickly, the 3 days gave me enough that I felt like I wanted more right away. I didn't want to wait. And so really it was like dangling life in front of me that gave me the ability to make that jump and say, I'm going to take 6 weeks off and do this for me and my family.
Yeah. I mean, when you actually get that opportunity, that you actually see some replenishment, like I remember when I first started, like really immersing myself in personal development, and my coach said to me, I was really burnt out this time last year. She said, see 2018, and I remember the first few months of 2018, see it as your 3 months of replenishment. Like, you've just been so thirsty and hungry. And I remember, I don't know, some of you watching might have seen that really brilliant animation called The Prince of Egypt, about Moses and Moses' story and Pharaoh's story. And there he leaves Egypt because he kills somebody and he's being pursued, and he's in the desert, and he's there by the well, and he's just drinking that water after being in the desert for so many days. And that's how I felt. I felt like I just needed to just drink as much, because I'd been so, like there was like no, like water or nourishment within me. And all I needed to do was just replenish myself, because I was so empty. And you kind of hinted on this, but I really want to kind of talk about it, because I know there's a lot of doctors and healthcare professionals listening. Was it easy to, as a doctor, as everybody looks up to you, to actually accept that help? I mean, because there's a lot of shame and embarrassment. I know social workers feel like this, to actually even say, oh, I'm struggling, I'm not okay, I don't feel okay.
Yeah, I think that's a great.
We've got problems. I apologize, it's not a very good connection, but this is the joys of being online, I'm afraid. Sorry, did you manage to hear my question, Shawn?
I think it's a great question, and the short answer is no, I did not find it easy. I think there's a lot of stigma associated with it, and I think some of that is perceived, that my shame keeps me from admitting I've got a problem. And I think as a surgeon, I probably had more of that than the average bear, if you will. Because we're trained to go through whatever. It doesn't matter if it's the brick wall, you just run through it. And so there was a lot of difficulty I had in personally saying, okay, yeah, this is what it is, and I'm going to take care of it.
Mm.
And then I did get some repercussions from some colleagues. A lot of people were very supportive, but there were some people who were not so supportive and looked at me with a tainted eye afterwards. And, you know, you have to come to terms with that to a degree. But in essence, from my perspective, if I had not done something proactive in a sense, I think it could have easily led to a drug or an alcohol problem or something that would have been much worse for me from a licensure standpoint in the end. So that's another thing that prompted me to come forward is I felt like I was very fortunate and that I didn't have another layer of problems on top of my big problem already. I think getting help earlier is better. And in fact, I'm a big advocate for coaching in medical school, for coaching in residency, for, you know, having healthcare professionals, mental health care professionals available for people throughout to be able to vent about traumatic instances. And it isn't even, like you said, just trauma. I mean, we see the body broken in ways that cause most people to be repulsed. And while we're trained to deal with that, some of that has an effect on us whether we realize it or not. And then the emotional things we deal with on a daily basis. I think it's important to learn how to unpack a lot of that emotionally.
I mean, I think sometimes when you're kind of dealing with that day in, day out, you kind of normalize it. And I think sometimes, like, you know, when you're dealing with trauma, whether that's physical trauma or mental trauma, when you start normalizing something, it gives you a really skewed perspective on reality. It's like social workers, we're constantly dealing with domestic violence, child sexual abuse, I don't know, really sort of like dark things. And then it makes you think, well, the whole world is dark, and you don't see the light and the joy and the happiness and sort of like just having, you know, the nice side of family life, because you're just constantly seeing the dark aspects. And I think what your point about you were lucky to be, you know, have a really supportive family and be in community. And I think there are some people, I'm sure, that are watching and listening that don't have that don't have that sense of community. They are very isolated. And I just kind of want to ask you, what advice would you give if somebody is like, because I know there are some social workers that kind of live away from their family, they're healthcare professionals, that their family are like thousands of miles away or maybe even a different country. I mean, what advice would you give for somebody that isn't kind of very near their, you know, their families or living in a community or in community?
Yeah, I think some way, shape, or form, you have to make a human connection, and it doesn't have to be a sister, a brother, a mother, a father, a spouse, although those are all wonderful. It could be a colleague that you feel like is trusted, a good friend, but you've got to have someone you feel like you can go to and be real with. And I think part of this process is about telling the truth of our interior environment. You know, what makes me sad, what makes me feel hurt, what makes me angry, what makes me glad, and being able to be honest about that with someone. And then as a result of telling the truth of your experience, which is a reflection of who you are, the process of doing that is a very healthy process, and trusting that process allows you, I think, to do a lot of healing as a result. So I feel like that community, whatever it is, whether it's a mental health professional or a trusted friend, is vital in trying to recover and keep your heart.
Keep you together, keep you human, keep you. I mean, I know that the colleagues that I have, you know, within my social work team, is a multidisciplinary team. We have a nurse, we have a psychologist, we have social workers, we have youth workers, I think that's probably why I have stayed in that, particular team for like 21 years, because it is like a community. They're not just work colleagues. They're kind of there for you when you are feeling, sometimes really traumatized by a young person that's been demonized and marginalized, when even other professionals are seeing him as this awful, evil person, and you're just seeing him as a child. And I can go to my colleague and actually just sometimes cry the fact that, the whole world is demonizing him, and yet I just see him as a child. Yes, he needs guidance, he needs supervision, and he needs, risk management, but he's still a child. And I kind of wanted to ask you this question, and you might not be able to, ask it, but I think you kind of understand some of the issues that social workers face. As a doctor, do you think burnout manifests itself differently in healthcare professionals than it does as social workers? Do you think there are some differences, or would you say that there are mostly similarities?
I would say that in the end, burnout is pretty much the same. Firemen, teachers, social workers, physicians,
Mm-hmm.
all experience it in the same way because they're all human.
Mm-hmm. Mm-hmm.
And a lot of it has to do, and in fact, in some studies, it demonstrates that the more compassionate you are, the more likely you are to suffer from burnout.
Mm-hmm. Mm-hmm.
So part of that and it also makes us susceptible to the same effects of burnout.
Okay, I hope people heard that. I think I'm just going to repeat it. I think Dr. Shawn Jones just said that sometimes there's, because we're all human, there is a lot of similarities between social workers and healthcare professionals in how they experience burnout. And sometimes the more compassionate you are, the more likely you're prone to burnout. Is that a good summary of what you said? Because sorry, it was becoming really broken what you were saying. Is that a good summary of what you just said, Dr. Shawn Jones?
Yes, absolutely. I think that's true. I think basically at the end, it's a human problem and people who are in the helping profession. So,
Mm-hmm. Yeah. And what would you say would be I think somebody said this to me, and I'm just going to put it to you. I think sometimes the like social workers, their job isn't really respected. Sometimes not even understood. I think in the US, I'd say it's the same. And in the UK, it's not really understood. It's not really respected. Whereas doctors, they get a little bit more prestige. It's a little bit more respected. There's a little bit more financial remuneration. Would you say then that the manifestation of burnout because of that lack of prestige is a little bit more? Do you think social workers are a bit more prone to it because of that? You would have seen Dr. Shawn Jones today. You would have seen Deborah Hurwitz. You would have seen Maman Yusuf. You would have seen Louisa Havers, Dr. Lisa Hartwell. I hope when you are actually watching, if you could actually just reply to the emails that are being sent to you, and actually just tell me what have you been your biggest takeaways, because I would love to know. What would you say maybe the top 3 signs and symptoms that people should watch out for within themselves that might sort of suggest that they are, on the way to burnout?
Well, I think that, there are a multitude of ways in which this can present itself. But in general, if you are in one of the helping professions, particularly social worker, nurse, teacher, fireman, policeman, and you find that you're having a very difficult time dealing with people or situations which used to not give you any difficulty at all. You're sort of done with people, in essence.
Mm-hmm.
That is I think a telltale sign. And I think one of the other things is if you tend to feel or to treat people as if they were objects rather than human beings. Mm-hmm. And probably one of the final steps is when you begin to feel as though you don't get any satisfaction out of your work whatsoever, that it's just, you feel like you're trying to do your job and it just doesn't matter whether you do it well or badly or poorly. Mm-hmm. Things don't matter anymore. Mm-hmm. Those are all three pretty big signs, I think, that you're in danger of experiencing a significant burnout.
Yeah. Oh, that really, I think you've just summed it up so well. Thank you so much, Dr. Shawn Jones, for joining us today. And I will be here tomorrow with another interview. Thank you for joining me, Taniya Hussain, for this Beat Burnout interview series. Thank you. Bye.